Hello, everybody. I'm Becky Pospisil, and I'm the Director of Mission Delivery at Above and Beyond Cancer, and welcome to the Cancer Education Series. Tonight, my guest is Angela Mickens. Hello.
Hello.
Sorry for our delay. There is a torrential thunderstorm going on outside that some of us had to drive in, so we apologize for our delay. But we're here now, and I'm so excited to talk to Angela tonight about Black Women for Healthy Living, which is a nonprofit organization here in Des Moines. So welcome.
Thank you.
So nice to have you. So why don't you, before we get into your role at Black Women for Healthy Living, why don't you tell everybody a little bit about yourself?
Okay. So I professionally, I'm a nurse. I work in surgery department.
Oh, nice.
Been in there for 20 plus years.
Wow.
And my focus is a variety of specialties from neurology to general to plastics to ENT. I have 5 children, 6 grandchildren. Life's busy, so.
You are busy.
Yes.
That's awesome. Well, we love a nurse in the house, and we love our nurses. That's awesome. And, you know, Dr. Deming always likes to ask everybody, where did you go to high school?
So originally, I started high school here at Hoover High School.
Okay.
And then I left here my junior year and went to Memphis, Tennessee, and graduated from Sheffield High School there.
Okay. And then made your way back to Iowa at some
Yes.
point, right?
Yes.
Okay, very cool. That's awesome. That's his favorite question. And Dr. Deming, of course, is on our transformational journey right now. He is somewhere in Nepal in the high
nice.
Himalayas. I believe they are starting their hike, I think today, if not tomorrow. So we wish him well, and he'll be gone for the next 2 weeks while me and Alissa McKinney are covering the Cancer Education Series. So thanks for being our guinea pig for those of us that are not typically the hosts of the Cancer Education Series. So, all right, well, let's get right into the organization. So tell us all about Black Women for Healthy Living.
So Black Women for the Living is a nonprofit organization that specifically focuses on the health disparities that impact Black women in Iowa. I have to stress that in Iowa because there are other organizations in different states that have a similar programming,
Sure.
and so that we don't miss the women that we have here, we want to kind of focus with Iowa only.
Nice. Okay, and how long has the organization been around?
We are 5 years old this year.
Okay. Awesome. That's great.
Yes.
So you're here in Central Iowa, and you're focusing on Black women and really tackling health issues for Black women in Central Iowa.
Correct.
So tell us about the different programs you have.
So the different programs that we have breast cancer support, where we support our survivors and our fighters. We have heart health with health literacy about healthy living styles, intentional movement. Then we also have social for mental health and emotional health, well-being. So we do things holistically.
Okay.
And we also have a maternal health aspect of as well, where we provide baby showers to expecting mothers and newly delivered mothers. At those baby showers, they get a baby starter kit. And then they also are there to speak with a healthcare provider, a OBGYN, to ask those essential questions that they didn't feel comfortable speaking with their own provider.
Sure.
Then we also have like a pediatric doctor there to be able to talk with those ladies about infants, about the health, about their getting rid of misinformation about vaccines and those type things. And then we do provide them with baby CPR as well.
Oh, wow. That really is a lot that you offer,
Yes.
not just for, adults, but for new moms and their children.
Yes.
And what a great resource that is.
Yes.
So how do people how do they find your organization?
We have our website, which is www.bw4hl.org.
Okay.
The website is intentional about its information. It's user-friendly. We use everyday language. We have a green book so that they can see a picture of the providers.
Nice.
We break down each facility. We do have Richard Deming's information on there so that if they need to know what that facility offers and programs that they have with all those contact information. We like to give them choices just because sometimes their insurance does not cover those specific systems.
Sure.
So we want to make sure that we take all barriers off the table so that they're able to participate with their care.
That's awesome. Oh, what a great resource. So you did talk a little bit about barriers that Black women maybe have for getting proper health care.
Correct.
So let's talk a little bit about what that looks like for maybe somebody that doesn't understand what that might look like for a Black woman.
So for like a Black woman, typically in the Midwest area, barriers could be access, health literacy, trust is a big one, and the other one is getting cultural competent care.
Sure. Let's talk a little bit about that last one, because I think
Yes.
that's something a lot of people don't understand.
Right. So the cultural competent care is addressing any type of implicit bias that anyone has. Implicit bias is something that you don't realize that you have. A lot of us, it's just because how we were brought up, or things that we have thought that we knew that was okay to say or neglect or not do for someone, or those stereotypical things that some different cultures are labeled, and we end up using that in our practice.
Sure. So unintentionally, maybe not providing the best care because of
Correct.
some bias that you have that maybe you're unaware of.
Correct.
So that could be, I'm sure across the board, right? Like that probably happens with men and women, but
Correct.
certainly with Black women, you hear, maybe not being told that their pain tolerance is,
Correct.
incorrect and they're not getting properly served. So you do hear those types of things. What an interesting thing to really be able to identify and then build trust with a new provider. I mean, I'm sure that is really helpful for the ladies that you serve.
Correct. So what we do is that when we do our educational part of it, we advocate for them to understand what health literacy is, understand your circumstances, get those information out to them, and then also we give them a health care card. These are cards that when we see them at that time, this is what their blood pressure look like, their pain level, their blood sugar, those type things, and then they take that with them.
Okay.
And some women just don't have there's so much mistrust that has occurred that they still don't feel comfortable. So then we do send a medical advocate with them to help write things down for them, ask those questions as well, so that they are able to get those answers that they need. Sometimes I know a lot of providers will say, I gave them a after visit summary, and they give them a piece of paper. That after visit summary still, even though it's in English, that medical language sometimes is like a foreign language to a lot of people.
Oh, yeah.
So there's no understanding for them.
Yeah.
So we kind of break that down so that it's absorbed easily for them to be able to understand what's going on with their health. And then also, if we feel like that provider is not understanding them or just not really able to listen, we let them know that they have the right to pivot to another provider that would be better fit for them. And it's okay to do that. Sometimes, just like I tell them, if you go to a beautician and that beautician does not listen to you and she puts something in your hair that does not work well with you or the wrong color, you will pivot to another beautician.
Right. We don't even think twice about it, right?
Exactly.
Yeah. Putting your beauty in front of your health, that makes a lot of sense. And I suppose that's something that a lot of us probably take for granted, like having a little bit of background in healthcare. You might understand some things that, George has got you all hooked up now. If maybe your parents taught you some certain things about like maybe you went to the doctor a lot when you were a child, or your parents went with you and explained things to you. And maybe if you didn't have that, or maybe if your education level isn't, you're not able to understand. I mean, you're right. Those after visit summaries can be really complicated. And sometimes they put things in there that maybe you didn't talk about, right?
Yes.
And it's new information. So what a great resource. It's almost like there should be a class. I mean, we should all have to learn some of these basic things maybe in high school, or, as along with some other things, I'm sure. So that's awesome. I love that. So how do you find trusted providers? Do you just really open your network, like any doctor can work with you, or are you just kind of an open resource for that?
So it's kind of basically word of mouth.
Okay.
Right? So we tell patients, and this is for any patient regardless of culture, background, race, or ethnicity, or sexual orientation, if you have a good experience with a provider, each hospital, facility, clinic has those patient satisfaction surveys.
Okay.
Please fill those out so that they know that they are doing a good job.
Okay.
And then also fill those out if there's some areas that they need to improve on.
Sure.
And so basically, if a lady comes to us and say, "Hey, I seen this doctor. She's new in town, blah blah blah," we're like, okay, we take very serious to that because recommendation from someone that looks like us, because we already know that there's not a lot of providers of color,
Right.
And so we always prepare our women to be able to have a provider that does not look like them,
Sure.
or a male provider as well.
Sure. Yeah.
And so surprisingly, we do have a lot of male providers that are available who are very well, that take care of women of color.
That's great. I love that. Yeah, that's something that many of us have probably not had to think about. So I think that's a wonderful resource. So in addition to what you're providing for the ladies that you serve, you offer some monthly programming, some breast cancer screenings. Let's talk about some of the things that you do to prevent, in the world of cancer, some of the things that you
Okay.
offer that may prevent women from being diagnosed or misdiagnosed.
So every other month we have a health coalition, right? And so there's a variety of information that we provide. But we always make sure that we do ask them about their preventative care.
Okay.
So we want to make sure that they've had their mammogram, if they've had their pap smears, if they've had their colonoscopies. We always make sure that we focus on preventative care. And if those things have been missed, then there's some other things that we can do with them to make sure that they get those done. We also see if they have a family history. People of color have very limited knowledge about their family history when it comes to medical. So we do partner up with John Stoddard, who's epidemiologist there, does have a program where they can do a DNA test to see
Wow.
what is available within their family history.
Wow.
And if they have those hard markers, then they get counseled on which other preventative things that they need to do.
Sure.
It's not just breast cancer, colon cancer. We also do the lung cancer as well, screening, those type things. Because we do know that people who are non-smokers also get lung cancer as well.
Right,
So-
right, especially in Iowa.
Yes.
Yeah, it's one of our top growing
Yes.
cancers. So that's an excellent resource and also a great way to educate people that maybe don't even know that they should be doing some of these preventative things, right?
Correct.
And who are the providers they can go to, and especially if they don't have health insurance or you need to go to a place on the bus route or whatever that might be. So
Yes.
nice. Well, that's really great. Okay, so I did look at your website and I was looking at all of the great things that you do, and I saw the Health Coalition and the breast cancer support group that you have. Is that a
Yes.
okay? So tell us about that.
So the breast cancer support group, we meet monthly.
Okay.
We meet at the Forest Library.
Oh, nice.
And that's intentional. It's a neutral place, regardless of religious background, experience. It's a nice, calm place for the women to come. We meet about an hour, because when you're a survivor or fighter, we know that time is an essence for you, or your ability to actually participate with
Yeah.
social gatherings.
Right.
Sometimes, we tell women you're not obligated to talk. If you just want to come in and just sit and listen, you don't have to stay the whole time. They have the ability to vent, cry, whatever they need to do at that time. We provide different resources each time we meet up. We've added different people that provide bras for women
Nice.
who are fighting those, who are actually had a mastectomy,
Sure.
those type things. We also have like mental health for those type therapy type things. And we provide a very nutritional snack. We give them information to access, like Above and Beyond Cancer, resource programs. That's something that which is kind of more than what we're already offering, or some additional support
Sure.
as well. And so they get those type things because we do have knowledge deserts in Des Moines, where people who need those services still are unaware that they're available. And a lot of times when they hear that cancer diagnosis, they don't hear anything else.
Right.
And if they don't have that support group, then they are able to actually grab that information and use it. We do offer journey walkers. So our Black Women for Healthy Living do have a couple of women who are retired who are available to walk with breast cancer support, fighters and survivors. Even sometimes after our survivors have rung the bell, they still have some emotional and mental,
Of course.
things that they need to work through because medical trauma, regardless what it is a medical trauma.
Right.
And so we do have that support for those women as well.
That's awesome. What a great resource. And I love the phrase knowledge desert. You hear food desert, medical desert, and that makes a lot of sense, right? And we may be unaware that there's parts of Des Moines that really don't have maybe easy access to a medical provider or unaware of what's in their vicinity or might have to get a ride or take the bus. And that's really great. So from your breast cancer support group, have you noticed a community that's formed from that? Have the women made relationships and done things on their own?
Yes, and it's remarkable that we do have what we call our core group of women. Okay. So there's 6 core group of women who surprisingly kind of remind each other, did you get your mammogram?
Wow.
When is your mammogram? And I think even with our fighters, I think the fighters think that once I'm done fighting, I don't need a mammogram.
Sure.
And then the survivors are like, no, you still need a mammogram.
Yeah, you still have to go.
This is still a thing.
Yeah, it's important.
Yes, and so that reinforcement of someone who's been through that also helps our fighters keep going, keeps giving them hope, like they can see the other side of this. This is what it looks like when I survive.
Yeah, that's awesome.
So it's good.
And you have a trusted relationship with somebody where they can maybe refer you to a provider that they worked with, or that's awesome. What a great resource. I love that. Well, I know Above and Beyond Cancer, we've started doing some partnerships with Black Women for Healthy Living because we know that cancer affects everybody, but especially the Black and African American population is more at risk for being diagnosed, especially later on in their stage of cancer. And so we want to make sure that our programming is available to the folks that access your programming. So we have worked together over the last year and attended some of your events, and that's been such a wonderful opportunity for us to reach a new population because, of course, we want our programming to be available to everybody, and we're working hard to make sure it's accessible with our program. We do have programming at Forest Avenue Library as well, and then at the downtown YMCA, knowing that accessibility is a huge thing for most people. So we are working on making it more accessible, and experts like you are helping us with that. So we love the partnership that we've had. And I know you guys do a lot with a Juneteenth. Yes. So talk about your events surrounding that holiday.
So Juneteenth, we have a Juneteenth tea, and so of course we do it on June 19th. And so we do it out of Grandview University, so it's a nice, another neutral space.
Nice.
And so we talk about, each year it's a different theme. And so this theme is I Am Enough. And so this theme, this year for 2026, we're reminding women, regardless of what you're going through, you are enough. You can fight this. You can make this. And so when it comes to cancer, it's not a death diagnosis. It's something that you just need to pivot and work with and fight. And then also huddle up with other people. Get the resources that you have. If the access is there, take advantage of those accesses. No more, hiding your diagnosis. We need you to be compliant with your care. Just having real talk with them about, because the cancer numbers and rates in the metro area is higher than other counties in Iowa. Yeah. We found that out when we did the Cancer Consortium with Polk County in January. So it's an urgency and an alert call for women to step up and not wait.
Yes.
When they're feeling something's not right with their body.
Right, and be vocal with their community, right? Like if you have been recently diagnosed or are receiving treatment, making sure that your friends and your community members are also taking advantage of the resources that are out there.
Correct. And
being preventative of some of the things, because you're right, yes, the Polk County rates are high, and we already know that that's a thing that we can't fix overnight. But what we can do is try to be preventative in some of these things, and then when the diagnosis comes, what can we do to mitigate side effects or reoccurrence or whatever the other things that come along with a cancer diagnosis and secondary diagnoses and things like that. So that sounds like an amazing resource, and it sounds like a great event. And you do have a walk also, is that right? Pretty in Pink walk?
Yes, so Pretty in Pink Walk, we do that at the Martin Luther King Park on the east side. And we have different speakers. Dr. Subek
Oh, yeah.
has did that several years.
We love Dr. Beck.
Yes, and then she retired.
Yes, I know. I mean, retired. We're hoping there's quotes around the retired.
Yes. Well, I think because she's been at it for a long time, she might be like, I'm going to come back a little PR in a little bit.
Yeah, that'd be okay. We'd take her back.
And so they get a little health literacy, a little encouragement, get some information that is needed, especially if they are women who are supporting another woman, because survivors need information as well. Survivors' families also need information as well. And if you are a person who was walking along a fighter who did not make it, you are a relative, we are encouraging you also to go get those mammograms and those preventative tests done, just to make sure that you are okay.
Right.
Just because mom had it, I don't have it. If mom had it, you still need to go get checked.
Yeah, even more so probably
Yes.
because genetically it could run in your family.
Yes.
Yeah, that caregiver support is huge, and I'm sure, when a survivor doesn't make it through their cancer journey, there is grief associated with that, and needing a community around you to lift you up and support you and make sure that you're doing all the things you can do to prevent a similar diagnosis would be a really excellent thing for the community. So, along with the work that you've done, how can the community support your organization?
I think there's three ways that the community can support our organization. One is to help us intentionally,
Okay.
get the word out to Black women for they're able to assess our programming. Like I said, there is knowledge deserts in our area, and so just making sure that those women hear about what we provide. Two is to partner up with us. Or provide us with partners that would be supportive of our mission and our vision in supporting Black women with health disparities. And then, of course, three is financial, helping us get sponsorship or any type of granting or those type things. We are a nonprofit, so everyone that is on the board are volunteers.
Yeah.
And so we have some of us are retired, lucky them, and then the other ones who work full time. And so, but we do this because this is part of our passion, and we really care, and we want to be able to stand and say that we support Black women in our community, and that they are not heavy, they're easy to carry. It's just that we need someone to do it intentionally.
I love that. Along with that, how can folks that aren't Black or African Americans support your organization? Is there something we can do to be an ally for Black women in our community?
Yes, allyship is amazing because you have more access to different resources. And that is where a lot of times there is a gap in what we are able to do. And so I would just say, partner up with us, ask intentional questions. We do say, we use, when we do our health coalition, we do use Drake and DMU and those type schooling, medical school, for them to be able to doing assessments on our Black women.
Okay.
Because we intentionally use people who are not of color because we want them to, it's a twofold thing. We want them to be able to get comfortable taking care of Black women, and then we want our Black women to be able to feel comfortable with a provider who doesn't look like them.
That makes sense. Yeah.
And so those little small intentional things is an allyship for us.
Yeah.
So that there's not a huge overhaul trying to educate them about health literacy and building trust with the healthcare system, that type thing.
That makes sense.
Yes.
Yeah, what a great concept. That makes a lot of sense, especially catching medical students early in their career,
Yes.
right? And making sure they understand some of the differences between Black women and non-Black women.
Yes.
And that's a great concept, and I love that. So let's say I'm somebody who's watching tonight and I'm a healthcare provider in some capacity. Is there opportunity to volunteer or work with you in those types of situations?
Yes. We tell all providers just to reach out to us, let us know what your specialties are.
Okay.
And then also so that, when you're available, because we know all providers have a certain schedule.
Sure.
And they can do a health coalition. We have our Black Women's Health Conference in August.
Oh, great.
And it's an all-day conference, so there's different subjects that a provider can participate with.
Okay.
Or if there's something that they want to demonstrate or something that they think is very urgent for them to know, we just want them to reach out to us and provide that information. We do vet people. We've had people reach out to us that's not really attached to a system.
Sure.
And to us, we really want to make sure that we're giving correct, accurate, and up-to-date information.
Sure.
So we do vet our providers.
That's great. As you should.
Yes.
So if you are in the healthcare industry or a provider of some kind, and this sounds like something that you would like to do, you can reach out to Angela and her team, and they can see if you would be an appropriate fit for helping out with that, which I think would be wonderful to access more of the community. We have a lot of providers that support Above and Beyond Cancer that I'm sure would love to learn more about how they can support Black women in Iowa. Love that.
Perfect.
So I had a thought, and I was trying to think of what it was, and it slipped my mind now because we were talking about your health conference. Yes. So tell us about that, because we have a conference coming up, but our conference doesn't focus solely on Black women. So tell us about your conference.
So our conference is a holistic conference. So we start in the morning with basically what we call a confidence session. So our first speaker is to pour into our women, just get them kind of pumped up for this conference. And then we have what we call different classes. Last year we had a financial pathway. Nice. We had caregiver pathway. We had end of life pathway. We had in OT, occupational therapy, physical therapy, and then we had doulas, and then we did have one about menopause, and then one about cancer specifically.
Wow.
It didn't matter what type of cancer, but just cancer specifically.
Sure. Wow, that's a really robust conference. It sounds like. So really it's kind of for anybody, right?
Yes.
In any type of field, so they could really pick the track that works best for them.
Yes.
Okay, so you're planning on having the conference this year?
Yes.
Okay, wonderful. And where's it at?
It's going to be at Grandview again.
Okay, great. Accessible location. We love
Yes.
that.
August 15th.
Okay.
And so, we got some feedback. So we do, if you have attended a conference before and you gave feedback, we do take that feedback very seriously. And so, we're going to add a panel section to our conference. We do have our panelists out, and it's 6 women about preventative care.
Wow, good.
Just straight preventative care. We have a dermatologist, a gynecologist, a mental health, PTOT, cancer. What was the other one? Sorry.
It's a lot. It's a big panel.
And these ladies are answering intentional questions.
Okay.
And so then you get a feel that each one is interconnected with the other. So this is holistically, we're dealing with the whole person.
Nice.
And so they are providers who do provider service.
Okay.
So this will be a good way where people can be more compliant with their health, and then also be accountable.
Sure.
So we're telling people you're wanting your provider to be accountable in providing a service. We also want you to be accountable in participating with your service.
Right.
So.
Yeah, great. So would you say the conference would be appropriate for just anybody, or medical providers could also go and learn about how they can better support Black women? Would that be appropriate for people in the healthcare industry? Is it really focusing on anybody in their personal journey?
So the conference is a safe space for Black women to learn. And if you are a provider who is of color, you're welcome to come as a participant if that's what you choose to do. But the conference is meant for Black women as a safe space for them to get the information that they need of whatever health disparity that they're dealing with or family member.
Sure.
And then take that information and use it to better themselves.
Got it. Okay.
But we do have vendors that are there and partners and allies and support groups that are there that provide information. But as far as actually being in the conference, those are safe spaces for Black women.
Got it. Sounds good. So, great resource for you if you know somebody that might be interested in attending the conference or yourself. You can find the information on your website.
Yes.
Is registration open yet, or will it be coming?
Not yet,
Okay.
almost. We have to get past Juneteenth and then we open up.
Oh, gotcha.
Yes.
I understand. I know how that goes.
Yes.
That's awesome. Well, it sounds an excellent resource and one that we would be happy to share with our folks as well if that seems like something that they'd be interested in. It
Yes.
sounds like a really great, robust conference. And we love locations filled with educated women. I think that's great. And so having a panel of 6, healthcare providers, I mean, what a great way to get
Yes.
questions answered and maybe meet your next provider in that room, which would be
Yes.
a great opportunity.
And these, we will always stress that your primary care doctor is not a lone provider. You need other providers to huddle up.
Sure.
So it would be a great way to get other providers to be part of your care team.
Sure.
And so that's one of the things that we're hoping that we can get more and more women to understand.
Yeah, that makes sense. And probably something a lot of people don't understand about the medical system, that your general practitioner might not be the right doctor for this issue that you're having, right? And it's okay to be referred to someone else and find someone that can work with your doctor and help you tackle whatever issue you're
Yes.
having. And that makes a lot of sense. Very good. Well, what other events do you have coming up or things that we should know about with your organization?
Oh my, let's see.
I know we covered a lot of them. We have a lot.
So we will be having a meet and greet at the end of May, so May 30th. That meet and greet will be where all members or anyone can meet and is open to the community, who would meet our 2026 board members and also our 2026 advisory committee.
Okay.
And the advisory committee are providers and professionals who will give us information, guide us into what we need to know to be able to share with women of color. And so we are excited that we've had several providers who are willing to sit on this advisory committee.
Yeah, that's great. That's wonderful. So what's next for the organization? What do you see down the road for Black Women for Healthy Living?
I see for us to expand our reach a little bit. We do get calls from Iowa City and from Waterloo. And so I know that someone asked if we could do things virtually.
Sure.
And I think right now, it's more better right now for us to do it in person because we really are trying to get women to prioritize their health.
Yeah.
And since we serve women between 18 and above, if we go virtual, we do lose a huge amount of women who are not very tech savvy.
Yeah, of course.
And so we just want to make sure that it's available for all of them.
Makes sense. Okay. So hopefully someday you can expand to other cities in Iowa. Wouldn't that be great? We're in the same boat. Like, you really lose that personal touch with the virtual. But for some people, it might be the only way they can access, which is hard. So it is a balance, right?
Yes.
Sure, for you guys, you're really focusing on building that relationship with the person that you're serving, right?
Right. Because we do, like if we do get calls where a family member would say, my mother or my grandmother or whoever is unable to make it, can you go to her home? We do go to their homes and do an assessment. We do go to their homes and provide them with the information that they need and the resources that they need. So we do that. So beyond our journey walkers, we do have medical advocates, and then we do have what we call home warmings, where we actually go to their home and see what we can do to help them.
Wow, that's great. Really meeting people where they're at, which is awesome. Really takes down some of those barriers, which we all experience, right? Especially if you're not feeling well or not able to be as mobile as you used to be, and that can really make it difficult, I'm sure. You understand what that's like as a nurse, so you really have a unique perspective with that, I'm sure.
Yes.
How do you think your nursing degree and your experience working in a hospital system has allowed you to be successful in this role and really serve the Black women in your community?
I think it gives me a better visual view of both sides of it. I see the healthcare side of it where, our expectation is that a patient will come to us and we do what we need to do for that patient, and that's it.
Sure.
And then I see where, from the Black woman's perspective, is that I come to you and I'm expecting you to know everything.
Right.
And I tell them they don't know what you won't tell them.
Yeah.
And you have to be honest and open and honest with that person. They have to be your best friend. You have to be able to tell them, because they're not detectives. We investigate, but we're not detectives.
Right.
So it's easier for us to treat you if we know everything. And then the other side of it is that, well, I'm not going to trust you because someone has mistreated me. So
Sure.
there's that part of it that I see that there's a difference. So that's the reason why we are trying to be a bridge in between
Makes sense.
the healthcare system and Black women.
Yeah, that makes a lot of sense. You really do have a unique perspective from both sides of it. And our healthcare providers are stretched pretty thin, right? And they only have limited time, so you really have to take advantage of your time with them, I'm sure. And if you've had medical trauma in the past or not treated well by a previous provider, and then you're meeting someone new for the first time and you're supposed to tell them all the things that are going on with you, that's really hard. I mean, for anybody, but especially if you've had medical trauma in the past. So I think that probably the right person for this role, it sounds like. You can really bridge the gap, which is
Yes.
great.
I try, but yes.
Well, yeah. So I mean, that's all you can do, right? Is give people the information. And I love what you said. You don't know what they don't know what they don't know, right?
Right.
And that is something I even say that to my kids. Like, I don't know what I don't know. Like, you have to tell me, right?
Yes.
Like,
Yes.
And it's a concept adults need too.
Yes.
Like, we do expect, our healthcare providers in the 5-10 minutes that they see us to be able to figure you out and fix you, and it doesn't always work like that, right?
It never works that way.
Well, never.
It
Yeah.
never works that
Yeah.
way, because even if they don't know what labs to order for you, what tests to run, and if you're sitting there and you're in pain, and the only thing you're saying, I'm in pain.
Yeah.
Well, what type of pain? Is it between 0 to 10? Is it a pain you've always had? Is it chronic? I mean, those are details that your provider does need to know.
Sure.
So they're able to do what they need to do for you. But if they don't know, they're only doing what you're presenting to them.
Right.
And so that is a hard hitter for a lot of people. And unfortunately, our providers do not have that extra time
Sure.
to dig. And that's what we call it, is that when you're digging for more information, and sometimes providers don't know what questions to ask to actually get that information out of a patient.
Sure.
So my part, Black Women for Healthy Living's part, is to provide a health literacy to get women prepared for their provider.
Yes.
To write things down. This is what's been going on. If I have this pain, write the date that it started so that they know how long this has been occurring. If something's new with your body, make sure you write that down. You can take that in. So that gives you something for your provider to start with, to
That
be
is
able
great
to better
advice.
take care of you.
That is great advice. I mean, that makes a lot of sense. You can really prep them for so they can really have the best advantage while they're at their doctor's appointment, and really kind of hit everything that they need, and hopefully give their doctor or their provider all the information that they can.
Yes.
That is, I think everybody can learn from that,
Yes.
right? Like, I think you're right. When you're in pain, all you can focus on is the pain. You may not be able to think clearly in the moment, or maybe you're nervous, and you're all of a sudden somebody's asking you a million questions and you can't remember, you can't come up with it. Not all of us can think on the spot.
Right.
And especially if you're not feeling well, right? So what a great resource, and something we can all learn, right? Is like maybe take notes in your phone or write it on a piece of paper. If you know somebody that is going to the doctor and they've been having chronic pain or having health-related issues, maybe you can help them with that before they
Yes.
go. That's a way that you can assist people in your community, right? Is
Yes.
reaching out to a neighbor or a friend, someone at church that might need that as well. Great advice. Well, we're learning something today. It's so funny. I even run into that too when I go to the doctor. Like, I have a couple of things that I've thought about, right? And then I get there, and then I'm like, oh, I forgot to ask them about this, and then it's like how long is it going to take for me to get back into my doctor? Or my well women visit is only once a year,
Yes.
right? So do I wait till next year to do it, or right? I don't want to pay another copay. Like financial, things are expensive right now. It's hard to go to the doctor and pay for it.
Right.
If you don't have health care, it's even more expensive.
And so we also teach them if they have those patient portals. If you got a phone, we help them get on their patient portal.
Nice.
And I tell them, send your doctor a note. It's okay. They'll have time to read it.
Yeah.
And if you can't describe it very well, take a picture. Your patient portal allows you to take a picture. It
Okay.
doesn't matter where the picture is of.
Sure, yeah.
Because your doctor has seen it all.
Yes, they have.
That's his job.
Yep.
And so take a picture and send it to your doctor.
Yeah.
And if it's something dire, then they'll reach back out to you.
That's good advice.
Yes.
We're not bothering our healthcare providers by doing that. That is a resource that you are paying for. You know,
Yes.
it's part. Yeah, I mean, if you have health insurance and you're paying for it, you're paying for that my chart or whatever it is that your doctor's
Yes.
using. So it's there for you to use. If they didn't want you to use it, they wouldn't have that ability to message your doctor. So don't be afraid to message your doctor. That is good advice, I think, because I do think sometimes, especially women, and I'm sure this is even more so true for women of color, that we feel like we're burdening people with our problems, right? So we don't want to be like annoying, or I already talked to him about that and I don't feel like he or she listened, but if it's a problem, it's a problem, right? And you need to address it. And
Right.
so, yeah.
You're right. And it's also a good way for if you have already sent a message through that patient portal, right? And so it's already documented that you've had this pain.
Right, there you go.
And it's already documented you've had that symptom.
Yes.
And so you don't have to repeat it next time you go to the doctor's office.
Right.
Even if you forget, and they can remind you, are you still experiencing this?
Yes.
That helps open up that communication, and it gets your doctor to understand who you are and what you were going through.
Builds that relationship.
Yes.
And builds the trust.
Yes.
And they'll take you seriously, right?
Yes.
And that's what you need, right? You have to advocate for yourself in
Yes.
these circumstances.
Yes.
Yeah. Great advice. Wow. I really feel like this was really helpful. I mean, even for myself, as things to remember, like it's okay to advocate for yourself. It's okay
Yes.
to say, it's okay to switch providers. It's
It is
okay to
okay.
find someone that's a good fit. The same as we would switch someone who does our hair or our nails. If we're not happy with that, we wouldn't even think twice about switching, right?
Exactly.
So the same thing applies with healthcare providers, and that's great advice. Anything else you'd like to share before we open up questions to our audience?
I just think that regardless of your culture, it's important that you prioritize your health. I think I see a lot of people walking around in chronic pain. I'm not a physician, but I look and I'm thinking, ooh, looks like congestive heart failure.
We know the nurses know the most, okay? We know this.
It's kind of like, they got the little wet breath, and I'm thinking, I wonder if they're taking their Lasix. I mean, it's those kind of things. So I think there's a lot of people who are living unhealthy,
Yes.
and not the best of their wellness. And life's too short to be in chronic pain on a regular basis.
You only get one life.
You only get one life.
Yeah, and you should live it well if you
Yes.
can. Yes, that's really great advice. Thanks for sharing all of that with us, and hopefully we all learned something. So because of the thunderstorms and because of the Nepal trip, we have a very slim audience today. But do we have any questions, George?
Yeah, we've got a viewer on Facebook. Mary Stern says, thanks for the information. So we've got a little bit of an information oasis here in the desert that you were talking about, information desert earlier. I've got a question for viewers, people that are watching the show that say, well, this sounds great. There's information, there are benefits available, but I don't have any money. I mean, this is a pay-to-play system, so I can't benefit. What do you say to those folks?
I would say that there are resources and access out there for people who are in a lower income. It's just finding that information out, unfortunately. And you would think that information would be easily accessible to everybody, and it's not. If it's someone who has limited income, Polk County has a variety. Polk County Health Department has a variety of programming that fits people's budgets, or if they have zero income at all. And so they also have programs where they do 150 free colonoscopies, and they partner up with different care facilities. Like Mercy One would do 100 free colonoscopies. Broadlawns would do that. They partner up with these different facilities to be able to give that access to people who have low income. And so you just have to be able to go in and actually take access to those things.
So could they access that by going to Polk County, or would they go online and look for that?
I think it's both.
Okay.
And I know that we partnered up with them because we have sent women there before. Because they also do free mammograms. They do have a preventative care programming as well. And then also when it comes to medication, Broadlawns has a medication program as well. So does Polk County Health Department, because we do want people to stay healthy, and we know that inflation and different things change each year for people, but that access is available. It's just that you have to be able to know that it's there and actually take advantage of that.
And being an old news hound, I'm interested on the news on the national level, particularly the negative news about immigration enforcement. Is that trickling down to the local level? Is that affecting groups like yours?
Yes and no. It has had it where we had to pivot and maybe go to more homes than we did normally. There's the fear of actually coming out and participating. Right now, we're not really on anybody's radar, at least we don't think we are, but we do make house visits to accommodate that. And because most of the people that we do that is are refugees, and those are the people that we make sure that we take care of and that we actually bring the resources to them. And then we make sure that we have a medical advocate with them when we go to the doctor's offices with them, so they have a support person so they're not walking alone, because we still want them to be healthy.
Yes, for sure.
And wanted to make sure that I had the website address correct, www.bw4hl.org.
Correct.
Okay, I'll put that up on screen. So, and last question, I'm always interested in mental health, particularly when it comes to a cancer diagnosis and that type of thing. If I got a cancer diagnosis, I'd need some mental health assistance. I mean, that's available through your organization. Is that increasing as far as a need is concerned?
That need's always been there. I don't think it's increased. I think it's just something that we already think it's part of the programming, because we watch our women once they get that diagnosis, even after they've done fighting and they're into their survival. We tell people that when people are in survival status, they are people who sometimes think they're still fighting. We have women who are 13 years out and they're still in that fighting status. And so we do make sure that they do have a mental health therapist that they can talk with. And mental health is kind of a taboo in a community of color. So we make sure that their confidentiality is serious. We make sure that we keep anything that they say to us. So the support group is always a closed group. We don't take pictures. We don't record it. We just make sure that people know aware that it's there. So if you do see anything about our support group, it's just a flyer. We don't take pictures inside the support group. And if we do, it's because a family member has asked if a patient is going to be ringing a bell.
Sure.
And so then we make that an open session, but we let them know it's going to be an open session, so to make sure that they don't say anything that's sensitive, that because a lot of they're doing pictures or recording. So we just want to make sure we're protecting their confidentiality at that point. Hello.
One thing historically that has been important to African American women is their faith. Do you want to describe some of the activities that Black Women for Healthy Living have done in partnership with many of our faith-based organizations in Des Moines?
Yes. So we are Christian-based faith, and so we do our health coalitions inside the basement of Corinthian Baptist Church. And this gives us a way to be able to support our women in a manner where that we're dealing with them holistically, not just the physical part, but also the spiritual part. And then we also meet them at different spaces, but we always pray in and we pray out. We let them know that your health impacts every aspect of your life. And if any of those things are out of alignment, it impacts the other thing. If you're in chronic pain, that impacts your spirituality.
Yes.
If your spirituality is off, your emotional and mental health is off. So we make sure that we address everything, and spirituality is also one of our key aspects of making sure that women are addressing that. They do not have to be Christian. We just want to make sure that they know that they have to be connected to something. And their connection with something will help them keep moving forward with their health and well-being.
Yeah. Religion is a very personal thing for a lot of people,
Yes.
right? So makes them connect with that part of their body, which maybe they've not been able to through their whatever their health disparities might be. So that's wonderful. I love that. But you are open to any religion or any spirituality, which is great.
Because what I may believe, it doesn't matter. As a nurse, I take care of everyone.
Right.
And so even if a woman comes to me of a Muslim faith and I'm Christian, to me, I know that whatever she's going through is going to make her feel hopeless. And that's going to impact her health.
Right.
And so I can be able to take care of her by just recognizing who she is and what she believes and respect that, but still walk that journey with her. Because her spiritual upbringing is going to give her that strength to keep fighting.
Yeah.
And so we never want to interfere with that.
Yeah. We're all the same on the inside, right?
Yes.
And we all have our own sets of beliefs and morals and values, but we're really not that different at the end of the day. So that's wonderful. Do we have any other questions? Okay. Well, Angela, you are a wealth of information, and this was very educational. And we're Above and Beyond Cancer. We're excited to do more with your organization because we know that our programming and the health and wellness world, which is a little bit different than what you guys are doing, but fits very well together.
Yes.
We absolutely need to serve more populations in our counties and in our state, in the rural communities, regardless of who you are, where you're from, and what you look like. Cancer affects everybody, and our programming doesn't discriminate, right?
Yes.
It's effective for everyone. And I thank you for the work that you've done for the Black women in your community. It's wonderful that we have educated advocates like you who are representing women, especially in the cancer world, but beyond that as well. So thanks for all that you've done and
thank you.
continue to do. And you'll see us at many of their upcoming events this summer. So if you are supportive of their events, you'll hopefully see Above and Beyond Cancer. I just want to plug quickly that we do have a survivorship conference coming up on Thursday, June 11th, that is open to any cancer survivor or caregiver. On the holistic side, not nearly as beefy as theirs because we're new this year, but we will be focusing on the health and wellness aspect of how that can really mitigate side effects and help your wellness journey.
Yes.
So we encourage you to attend ours, and if you know someone or yourself that would be interested in their upcoming conference, it sounds like a great opportunity to really be surrounded by other educated people who can help you on your wellness journey, and we love that. So thanks again for your time, and thank you everybody for joining us for the Cancer Education Series. We meet every Wednesday at the Mercy One Health and Fitness Center in Clive, Iowa. And next week, we'll have our president, Alissa McKinney, hosting for one more week until Dr. Deming is back from his trip. So we are covering the bases for the doc while he's out having a great time in the mountains somewhere. And thank you for joining us tonight, and have a great night. Good job.
Thank you.